edition of pharmacology, where I'll be looking at antihypertensive drugs. I'm your host, Morgan Epika Yusufukama Jr. Be sure to subscribe and hit the notification button so that you can be updated on each and every post that I send. Okay, so now, without wasting much of your time, we're going to look at the antihypertensive drugs that are as follows. So we have the first one, which is referred as in the beta blockers. But before we go there, the drugs that are used to cure hypertension, we usually call them as an antihypertensive drug. And there is an acronym that I usually follow, which is A, B, C, and D. A stands for AC inhibitor. A stands for AC inhibitor. Then B stands for beta blockers. Then B stands for beta blockers, and C stands for calcium channels. Then D stands for diuretics. These are very much important, especially in a patient that is suffering from hypertension. You can either give them the beta blockers, you can give them AC inhibitors, you can give them calcium channels or diuretics, depending at what level as well as at what stage is that hypertension is. And you need to understand one thing, that each and every person has got blood pressure. It matters how it is, either whether it is high or it is. If your blood pressure is low, that one is what we call hypotension. Hypotension simply means that your blood pressure is low. Then hypertension talks about an increase in the blood pressure. When your blood pressure increases, that one it is called hypertension. Now, beta blockers, they have what we call adrenal receptor antagonist. Okay, now when we talk about antagonist, remember, muscles have got this tendency as well as property of acting as an antagonistic. What does the word antagonistic mean? It simply means that when one muscle is contracting, the other muscle does what? Is relaxing. That's what it means. Now, in this scenario, these beta blockers, they have what we call receptors. These receptors, they are the one that usually senses. They usually detect the beta adrenal receptor antagonistics. They usually sense any change in the blood flow. If there is an increase in the blood flow due to vasoconstriction, then they'll be alerted, and then they'll now activate the beta adrenal receptor blockers, the beta blockers, such as what? Antenolol. Now, you need to understand that for beta blockers, each and every medication that you want to give usually ends with LOL, which is low. Like antenolol, these are effective in all grades of hypertension. You can prescribe antenolol in all grades of hypertension. Then angina, coming from the word angina pectoris. This simply means if a person comes to you and then that person is complaining that they are having chest pain, they're feeling some pain in the chest, that one medically, we use the medical term for chest pain, it's called angina pectoris. Angina means pain, where in the pec major muscle as well as the pec minor muscle, the pectoralis major muscle and the pec minor muscle. However, following myocardial, when we say myocardial infarction, do you know what that means? That simply means that when you're, then cardio, we're referring to the heart. Muscles of the heart, they are now, remember the function of the muscles of the heart is that they help in pumping the blood by contraction as well as what? Relaxation. They usually help in that format. Okay, so now, if these myocardia, the muscles cannot pump blood effectively, do you know what will result? A person will start feeling dizzy. Why? Because blood oxygen is not reaching to the vital organ. Now, remember what we talked about in pathology, to say when nutrients are not reaching to the vital organ, such we attempt it to be, that is what? Ischemia, like organs that are not getting sufficient oxygen, oxygenated blood, as well as nutrients, then there'll be ischemia. Then hypoxia, we said hypoxia, it's as a result of what? A decrease in oxygen, what? Partial pressure. Decrease in oxygen partial pressure. And that's the reason why those people actually fly in an airplane. They fly above the crowd. When you go up, the higher you go, the lesser the oxygen concentration becomes. Oxygen per mwamba, it's very low. And that's the reason why when an eagle is fighting with the snake, what it does is that it will pick that snake from the tree. And so high, in the higher heights, it will go up where there is no oxygen, and the snake will die just by the virtue of reaching those parts. Because there will be no oxygen. And when there is no oxygen, then the snake will die. So equally, this is what usually happens. When a person tells you to say, I'm feeling weak, a patient comes complaining of weakness, especially if it is the female patient, you need to maybe assess the history of sickle cell anemia. You need to assess the history of hypertension. They're just female that you have low blood glucose, low blood level. The blood levels for women, it is lower than in males. In females, it is about 4 to 5 liters. Then in males, it's about 5 to 6 liters. The reason is simple. Because women, the reason why they usually have low blood volume is that thing. It's because them, they usually lose blood every month through the menses. Until when they reach at a point where that is at the age of 45 to 50, a menopause, which is called menopause. And when they reach at that level, their blood volume does what? Start increasing. And that's the reason why those women that are in that age of 45 to 50, there is how they behave, such that you can't even understand. There is how they behave, you can't understand them. Because they've never been used with an increase in the blood volume. And that's the reason why sometimes they usually tend to be, today they are okay, tomorrow they are fine. They usually tend to have periodic illness. Then they tend to have what we call nightmares. And also the levels of their libido, that is their sexual appetite, reduces. Why? Because the blood now, it has increased. These receptors that usually stimulate certain hormones, they no longer function. So that will usually happen. So however, they should be avoided in what? Asthma. If a person has got asthma, you should not give beta blockers. Do you know what will happen? Asthma, meaning, remember the pathway for the lungs, just like I said the other time, I said that the pathway for the respiratory tract usually starts from the nose. It goes into the nasal cavity, which we call the nasal snares. Then from the nasal snares, it goes to the larynx, pharynx. Remember the pharynx? It is what we call as in the throat. Then the larynx, it's the voice box, where if you want to speak, it is where your voice box is. And then in between the larynx and the pharynx, there is a leaf-like structure that we call epiglottis, which closes and opens. It closes when you are eaten. It opens when you are. Why our parents, they used to tell us to say that table manners, you don't talk whilst eating. Because as you are talking and eating, you will confuse your epiglottis. As that the food that you are eating, or maybe the drink that you are taking, it will go direct into the trachea. And anything that goes into the trachea, guess what? It really results into it stimulates what we call the cough response. And then you start sneezing, you cough until that thing has been removed out. Now, from the trachea, it goes direct into the lower part of the trachea, where now the trachea will now bifurcates. When the trachea bifurcates, it forms two tributaries, forming primary bronchus as well as the secondary bronchus. Then it goes down into the tertiary bronchus. And those tertiary bronchus, they are the one that usually form what we call the alveolar sac. And that alveolar sac, the word sac, it simply means these are sacs that absorb oxygen for gaseous exchange. Now, these alveolars, they are in two types. We have they are called pneumocyte cells. The cells that are found in the lungs, we call them pneumocyte cells. We have the pneumocyte cell type 1. The pneumocyte cell type 1, it is mainly responsible for 95% of gaseous exchange. And the type 2 pneumocyte cell, these ones, what they usually do, they usually give 5% just for protecting collapsing. It will protect the lung, whereby Within the respiratory tract, there are what we call ciliated cells, even these epithelial cells. What do? They help out wiping out, cleaning the lungs. And what usually happens is that we have normal squamous epithelial cells. But what usually happens is that when a person starts smoking, what happens is that those squamous, they will be converted. Remember, what is metaplasia? It's the change of a cell because it has failed to adapt to the situation. So the cell will change from the squamous into columnar. And the more it changes to columnar, those cells will start undergoing what we call hypertrophy. What is hypertrophy? Increase in the number of the cell or increase in the size of the cell. And when they start increasing, guess what? They will start forming cancer. And that's what now makes what we call lung cancer and whatnot. That's if a person has been smoking like the whole lifetime. The usually tends to have cancer. It might not show now, but it will show later in the near future. Because these cells, they are now changing. And that's the reason why the forensic experts, they usually appreciate cells. Cells will tell you the story of what is happening to a person. Even a dead person, you can still communicate through forensic expert, but the cells can tell you what even caused the death. Muntu chazikurika che mwine wake chepenze lili. But again, they'll tell you to say, no, we need to do postmortem to know what happened. They'll open up the brain skull and then they'll check the blood vessels. If the blood vessels were dilated or constricted, then you will be able to tell to say there was pressure. I remember witnessing a certain scenario at UTH where this woman, she died of, what did she die of? She died of, what disease was this? She had ovarian cyst. What is an ovarian cyst? What is an ovarian cyst? Hmm? It's like a cyst.
Is it like a fibroid?
Okay, somewhere just like that. Ovarian cyst, it's a cyst where when implantation occurs in the fallopian tube, especially the ampullae or the ampulla or the isthmus.
So a cyst is a pregnant.
It's a pregnant, but what usually happens is that for fertilization to take place, this is what happened. The sperm cells will go direct, like as in passing through the uterus, then they'll go into the fallopian tube. They'll first find what we call the fundus. From the fundus, there is what we call the isthmus. Then from the isthmus, it will get another part that is called the ampulla. Ampulla then will get the fimbriae where the eggs are. So when that egg has been fertilized within the fallopian, it takes 2 days for that fertilized egg to move it takes 3 days for that egg to move from the fallopian tube into the placenta, into the uterus. But what happens is that when the egg is moving very slow, ikakuwa na 3 days, it will be implanted with fallopian tube. And when they see it through they scan it. You to say, call your husband, we sign some document. It either we save the child or the mother goes, or it either we save the mother, then the child dies. It's a gamble, it's a 50-50 way situation. So as a parent, as a father, you'll be like, so those are what usually happen. Now, what happened is that for this lady, she was told to call the husband. But what happened is that when she went home, only to find that her husband it was something. And guess what? She just collapsed.
The woman
Yes, she collapsed. She had no energy to talk. She just collapsed and hit her head off the floor. And guess what happened? When she was lashed to the hospital, kufika kuja, it was already BID, brought in dead. Ufaka kumochari na pregnancy nshiyamba. Manje kuja, benzo kamba. What happened? The husband started saying story to save the girlfriend. But you know what? How it came to light. We started doing the post-mortem. Pa! Ngamba kuchosa vova. Kujua jo. Remove the stomach content, check there was no food poison. Open the skull, this skin yolk. It came to the front, and then this upper part was just red. Abana tengana chani. Abana tengana energy drink first. Hey. Then peppered. So sir, there was no grinder to open the skull.
So you
We use the chest, so there is these equipments that are there, the tools and the armor. And we started hitting the head, boom, 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 until all this part we marked it and then we moved, carried kapa mwamba, mochosa brain, kuifa kapaski, brain nabambo, cool and cells. The pressure was too much. Check the blood cells, they were constricted. And then from there we were like, no, this woman can't just die when just 40. What was the etiology?
Yes.
That's why I love pathology. I love forensic science.
Yes.
Because in here, they will tell you to say that the etiology, which are the causes, there are just two ways for you to find out the etiology. It either they are known or they are not known. If they are known, we usually call it primary etiology.
If they are known.
Yes, but if they are not known, we call it endiopathy. If the causes are not known, we usually call it endiopathy. So after checking the way the blood vessels was in the brain, the pictures was taken just for some other investigation. And guess what happened? The husband was summoned, gated, to say, no, there's something that happened. Until manje wamboneka munga wavuta wanawapereka kutocha. Amenya wa manje maboro dache. Napatipiza na mkazi.
That was the pressure. Yes.
So ndivyo unarengesa. Then manje wakuchikazi wa invade. Hey! Kwenze kanto. So that's what you reacted. So it was Enzeko. That's how it was. Excuse me. Yeah. Okay, primary and etiology when they are known. Then two, we have idiopathy. Endiopathy when they are unknown. So there is nothing that a cell can hide from you. It will tell you what happened. Then you just have to start investigating. And you get the phone, you check the last conversation. All those things, yes. Those are the major principal causes. And that's the reason why at every hospital now there is a police station.
Oh, no wonder
Yes.
why. Okay.
For investigation. Na wasiayo
Mm.
afunika mabwela. So that vakapeza talikuti vaendo tenga. No peleka. Because what usually happens is that when a person goes there, postmortem, that person usually becomes the government property. So the government will take the law into use. Yes. The chronic obstructive, that is pulmonary disease, as well as the heart block. We don't give beta blockers. Now, let's look at the specific name to these beta blockers. The first one that I just told us was antenolo. Antenolo, it is in form of a tablet. It usually contains 25 milligrams. And it has 25 milligram and 50 milligram, as well as 100 milligram. Then for the injection, why is it that for the injection, the milligrams there, this is microgram per mil. For injection, the dosage is small. But for tablets, the dosage is big. Why? That's a question. Why is it that mostly the tablet dosage, it is a bit higher than the injection dosage? It's simple. When you take the drug in form of tablets, it has to be, remember, pharmacokinetics and pharmacodynamics.
Yes,
So under pharmacokinetics, this is what now where you find to say that what the body does with drug. The drug has to be ADME. The drug has to be absorbed, it has to be distributed, it has to be metabolized, it has to be excreted. But what happens is that 10%, 90% of the drug that a person has taken, other part goes to the muscle, other ones, when the drug goes into the muscle, it becomes a pro-drug. And that's the reason why those people usually take medications. Every time they feel they've not eaten, there will be muscle metabolism. And that muscle, it will start now breaking down that drug which was in the muscle in form of a pro-drug. When you break down that drug which was a pro-drug, what happens is that the very drug becomes, after it has been converted, don't you know that kantu kalitsoka ngono ukakaponya ndipo kama concentration increases?
Yes.
Just like a pancreas kamunkuku kaponyera munkuku isasa kaza nkorula kaza isasa. So that's how it goes. So equally with these drugs, when metabolism occurs within the muscles, the drug which was in a pro-drug will be converted into an active drug. And once it's converted into an active drug, guess what? What will happen is that there would be weakness as well as dizzy. Because in your blood, it has already says that you've not eaten. So your blood level, glucose level, it is showing hypoglycemia. And sometimes if you stay too long, you've not eaten. Those are the people where they'll start moving as if monga bavina on my bones, especially in the joints. There is what we call muscle twitching. The muscles start twitching just anyhow. And besides that, the person will also start feeling weak and dizzy. They only feel well when they sit down and relax. Indication, where can we give this medication? To a person that has got hypertension or someone that has got angina, someone who has got an increase in the high blood pressure, you can give the medication. Someone who is feeling some chest pain, you can give antenolol. Someone who has got arrhythmias, arrhythmias, these are heart sounds. The normal heart sound, it's lam tam, lam tam, lam tam, lam tam. But if the heart sound, it is giving us the croak of sound, or any other unknown sound, which is contrary to what is normal, then you'll be able to tell and notice that this person is not okay. This person has got arrhythmias. Like I'll give an example what usually happen in a person that usually have tachycardia. What is tachycardia? Tachycardia is a situation whereby a person is just resting, not doing any work, but they are panicking in breathing. They are panicking in breathing. Others, they will tell you to say, for them, when it comes at night, as they want to sleep, Mama Vela Monga, like short of breath, that is dyspnea.
Yes.
They usually feel shortness of breath. And then sometimes it's as a result of, you need to check their background history. And that's the reason why if you want to know how well a person is, don't just hear what they are telling you. When take their blood, take it to the lab, examine it for everything. And once you examine it, guess what? Blood will speak real facts. And that's why the theologians, they believe to say the blood of Jesus speaks better word than the blood of Abel. Because that blood, it's the one that brought redemption. So even the blood that we are carrying, it carries even genetic disease. And that's the reason why certain threats, certain character, maybe from the first generation, second generation, third generation, maybe I can say this is the 10th generation. Characters that were maybe in the first, second, third, fourth, fifth generation, they'll be experienced 10th generation. And then you wonder to say, but how come? So. Then others, they will tell you to say, go and ask, consult from your grandma. She will tell you, because she's the one that usually keep these stories, Papa family. Even a certain character, into you need to consult. Maybe there is someone from this back generation who was doing the exactly things that you are doing. There is nothing that is new, so to say. Everything is something that was lived before. And characters will be just modified and then they'll manifest. And that's the reason kumakana is that no, uyu mwana hapana cheva uncle wake or maybe wambuya wake and whatnot. That simply tells you it's an the life that this person is living. That's why where we are coming from, history is very much important.
Yes.
Action for these antenodal. What do? They usually block stimulation of beta adrenergic receptor. You remember, right? The beta adrenergic receptors, they'll just block them. When they block these stimulation of beta adrenergic receptors, then they will lead into what? Decreased blood pressure. What does the beta adrenergic receptor does? They usually make the blood vessel to constrict, thereby increasing the blood pressure. But when you give antenodal will block these beta adrenergic receptors. When it broke them, meaning that these adrenergic receptors, they won't make the blood vessels to be constricted, and the blood vessels will become dilated. And then pressure is up where that's the mechanism. It's that. By blocking the action of the sympathetic nervous system of the heart. You know, sympathetic nervous system, there are drugs that usually stimulate someone's sympathetic nervous system. When you ask people, those that usually maybe love drinking, it's as a result of maybe the sympathetic nerve becomes activated. They'll feel happy for a short period of time. Then, this receptor, this activation will now stop because there is nothing that lasts for a longer period. So the moment it stops, guess what? The sympathetic nervous system will come in. And when sympathetic nervous system comes in, guess what happens? A person blacks out. As you come back and cheze. Which manje ija activeness ya chokam. Obwerache manje ija Yamazi, that is parasympathetic nervous system on the heart. These agents, they usually rely on the heart. The good part of antenodal, it takes away from the heart by not making the heart muscle to contract too much, by ensuring that there is relaxation as usual. Besides that, they usually slow the heartbeat, lessen the force with which the heart muscles contract and reduces the blood vessel contraction in the heart, the brain, and throughout the body. That's what this drug does. So we must know the action of these beta blockers. For all of them, they have same action, same WhatsApp group. So know this one, meaning that you've known all these beta blockers. Okay, now as you get the dosage, you can give 50 to 100 milligrams or distance forward. That one, it is just once daily. BD is just twice daily, yes. So side effect, each and every drug, no matter how thin, how something becomes special, it has your pasa wa Zimbabwe. No,
Which one?
I mean antenoro.
Or
Because
this-
its side effect, it is very bad.
Mm,
It brings about bradycardia. What is bradycardia? Imagine you're awakened, but your heart muscles are pumping very low.
yes.
You collapse and fall down.
Mm,
Imagine you are seated, or when you every time you feel like sitting, you're feeling fatigue all over. Yes. Not only that, it brings about what? Insomnia. What is insomnia? Loss of sleep. Those are the
yes.
people that don't sleep at night. 24 akachiriani ayangana muntu 0102 habwa 03, meaning that things are not okay. Those are just side effects. Then it also brings about sexual dysfunction in males. It usually brings about sexual dysfunction when you take this drug too much. It is also one of the drugs that can make someone to become impotent. This drug, so it's very like as in, it's not really advisable to give on a high dosage for this one. What are some of the implications? You need to monitor the blood pressure and also the pulse, and you need to monitor the patient for any side effect so that you give other medication. The other drug is propanolol. Remember, I said they all end with low. This is a tablet that has 10 milligram, 40 milligram, as well as 80 milligram. Dosage 40 milligram once daily. Side effects, it brings about bronchospasm. What are bronchospasm? Tulaso. When you breathe, you feel a pain in the chest. That is bronchospasm due to some spontaneous sympathetic neural impulses within the thorax. Then it also brings about bradycardia. Remember, you're awakened, but your heart muscle is pumping very low. That is bradycardia. And it also brings about nightmares. Nightmares. Monga niaja madrugs ya kuchainama. Propanolol, it's bad when it is taken in excess. Then it also brings about what? Insomnia. About postural hypotension. It can make a person to have low blood pressure. What are some of the implications for this drug? You need to assess for manifestation of heart failure. If maybe you check if your heart is trying to fail, or maybe you check the pulse rate regularly, okay? Or maybe you should do not withdraw the drug suddenly in a patient with heart disease. Don't also think don't even get blood from a patient that is having the blood disease, like this heart disease. Don't take blood, because the more you draw blood out of this patient, then the patient will become hypotensive. Then we have the second one, which are the AC inhibitors. AC inhibitors. These are the angiotensin converting enzyme. The angiotensin converting enzyme, they usually inhibit. What do they inhibit? They inhibit AC enzyme. What is AC enzyme? AC is angiotensinogen or angiotensin converting enzyme. And this enzyme usually becomes inhibited. When this enzyme is inhibited, guess what happens? Number one, you need first to know where this enzyme usually comes from. The AC enzyme, which is the angiotensinogen converting enzyme, usually comes from the lungs. It is produced by the lungs. Enzyme is produced by, the enzyme, the AC inhibitor, it is produced by the lungs. Then what does it do? It converts angiotensinogen 1 to angiotensinogen 2. Angiotensinogen 1 to angiotensinogen 2. Now, when this drug, which is called angiotensinogen converting enzyme, which is just enzyme inhibitor, this is an enzyme that inhibits the conversion of angiotensinogen 1 to angiotensinogen 2. Now, we must ask ourselves to say, what is the effect of angiotensinogen 2? Number one, if a person is dehydrated, take these points. Number one, if a person is dehydrated, the angiotensinogen 1, what it does is that it goes to the hypothalamic thirst mechanism center. When it goes to the hypothalamic thirst mechanism center, it is going to stimulate the hypothalamus from releasing an hormone that we call vasopressin hormone, or commonly known as antidiuretic hormone. When this hormone has been produced, guess what happened? This hormone will be transported by blood, because it's a chemical substance produced by the ductus gland in the hypothalamus, transported by blood to the targeted organ. What is the targeted organ? The targeted organ is the urinary system. And in the urinary system, it targets the bladder. Why does it target the bladder? It targets the bladder for one simple reason. Remember, the composition of urine composed of water, salt, and what? Urea. You've seen, huh? Urine consists of salt, water, and urea. So what happens is when this hormone goes to the bladder where urine is being stored, it is going to filter salt and urea, and just get water and send it back to the bloodstream. I can ask a question. Why is it that the bloodstream needs water? The blood vessels, even blood itself. Why is it that blood needs water for it to be, like as in to be doing all what, to be flowing through all the body organs and as well as the vital organs? Why is it that blood usually needs water for it to be pumped? Because of one simple reason. Blood has got what we call a viscosity. Blood has what we call a viscosity. What is viscosity? Viscosity talks about thickness. The viscosity of blood, or should I say the thickness of blood, is 4 to 5 times thicker than water. That's why they say, blood is thicker than what? Water. Or even if someone is your relative, that's into. What was the question, sir? The question was, what does it mean when we say viscosity? Viscosity simply means thickness. So blood is 4 to 5 times thicker than water. Okay, than water. So what really happens is that blood is too thick, and that's the reason why, if maybe a member of your family has done something wrong, you can't even take them to the police station. Carry its blood. But you just learn a lesson to say, next time since I pass up, I won't tell them to manage these things for me. Can you really take it as in and whatnot? But what really happen is that blood needs water for it to move. Blood is just like undiluted juice. I don't think if anyone can take undiluted juice. It is too sweet. And that very sweetness, it can usually denature the cells. And that's the reason why it's very much imperative, or rather should I say important, when we say that these blood vessels, they usually need water. And this water, when the water gets diluted with blood, it makes now blood to reduce its viscosity. And that's the reason why these cells such as what are these cells? AC inhibitors, the vasopressin hormones. They will ensure to say that they convert they will filter water from the urine. Then they'll get that water, send it to the bloodstream for what? Increase in the water levels within the blood vessels, so that blood can move freely. Yes. If you check someone, maybe you're checking them in the eyes, you can be able to tell if the blood is sufficient or it's low. And if it is low, you need to tell them to say they should be taking too much fluids, especially beetroots, especially those people that have got low blood volume. They should be taking fluid. What's the essence of taking fluids? Fluid will help them to do it, to concentrate, or rather to dilute the concentrated blood. Not only that, you need to give them a drug. There is a drug which is called erythropoietin drug. What? Erythropoietin drug. Erythropoietin drug, let me just talk about the very erythropoietin drug. Erythropoietin drug, this drug was gotten from the nature, from how this erythropoietin hormone behaves. How does the erythropoietin hormone behaves? This erythropoietin hormone, where is it produced? It is produced from the kidneys. The kidneys produces renin now. It will now bring up the stimulation of an hormone called erythropoietin hormone. When this erythropoietin hormone has been produced, guess what happens? It goes to the targeted cells. What are these targeted cells? The yellow marrow. Of course, where can we find the yellow marrows? We can find them in these long bones like the femur, as well as the tibia, and the fibula, and even the forearm as well as the humerus. It will go there and stimulate the process that we call the hormone will activate the release of the hormone erythropoietin. Once it goes to the blood vessel, it will activate the process called erythropoiesis. What is erythropoiesis? Erythropoiesis is the process by which all blood cells are produced. Yes. Where are they produced from? From the hematopoietic stem cell through the process called hematopoiesis. What is hematopoiesis? It's the process by which all blood cells are produced from the bone marrow, which is just the stem cell. And when they get produced, guess what happens? We get to have erythrocytes, the red blood cells. We get to have the leukocytes, which are the white blood cells. We get to have the thrombocytes, which are the platelets. So when these cells are produced, guess what happens? Then a person will have an increase of blood flow. Yes. In India as well as America, what they do is that if a person has got, they'll go a surgical operation that is called genetic engineering. Under genetic engineering, this is a situation whereby instead of allowing people to abort, why can't you get that very fetus? Because that fetus, it has got a stem cell. And that stem cell, it's a pluripotent stem cell, which has the ability to form a new lungs, new liver, new kidney, and new heart. So what really happens is that when they get that fetus, they can implant it through genetic engineering. And that person says sickle cell anemia. But does that guarantee that even the children that person will start having won't have anemia? No. No. They'll have anemia. They've just worked on that person. The generation to come, the possibility or rather the chances of them having anemia, they are very high. And it will happen. They'll also get anemia. And this is can have genetic engineering. And genetic engineering is costly. It's very expensive. Sometimes what they usually do what we call a bone marrow transplant. You can transplant a bone from someone, then for formation of blood, especially for those people that don't have sufficient blood. So this usually happens in patients that are having conditions such as anemia, sickle cell anemia, and whatnot. It's really happen. But again, that does not guarantee 100% that no person will be just okay. A person yes will be okay, but not the offspring. That's what it entails. Okay. Now, these AC inhibitors, such as what now? These they usually end with pril. We have enalapril. Enalapril, these drugs are very effective and they are well tolerated by most patients. They are effective. They're effective, meaning that, and that's the reason why it is the effectiveness of these drugs that usually makes the patient to tolerate them. They can be used in the heart failure, that is in the left ventricular dysfunction. When the left ventricle is not functioning properly, you can use these angiotensinogen converting enzyme drugs, inhibitors such as what? Enalapril. Besides that, you should also be they should also be avoided in the renal vesicular disease. Now, when we say renal vesicular disease, especially in pregnancy, we're simply referring to those people that usually have a renal infection. That is the urinary system. If the urinary system is not functioning properly, there is a dysfunction. Not only that, even the vascular system, that is just the blood vessels. Remember, there are blood vessels that usually supplies oxygenated blood to the urinary system. That is usually come from the descending aorta. Then it gives tributary. It forms left and right renal artery. It also forms left and right renal vein. These are the ones that usually makes the kidney to have blood supply. And what usually happens is that even hypertension can still occur in the kidney. That one it's called renal hypotension or renal hypertension. Okay. Most common adverse effect is in a daily persistent cough. Especially when you see someone is coughing, and you need to notice, okay, these are just symptoms. So these drugs block angiotensinogen 1 and angiotensinogen 2. This is what I was just talking about. They also block the degradation of bradykinin. Remember these bradykinin? These are used in the complementary system. We have the bradykinin as well as other ones. These ones, bradykinin in the potent vasodilator, e.g., we have captopril. That's another drug. You can give 50 to 150 milligrams per day. Or enalapril, you can give this one 10 to 20 milligrams per day. Or risnopril. This one you can give 5 to 40 milligrams per day. All right, now let's look at the angiotensinogen 2 receptor. Now we need to understand that the angiotensinogen 2 receptor, they are antagonistic. Agonistic is to contract. You see now? Receptor for angiotensinogen 2, they are antagonistic, which simply means that they bring about relaxation, not necessarily contraction. If I say clockwise, I mean going like this. If I say anti or counterclockwise, going opposite. So if we say gonistic, we simply means contraction of the blood vessel. When we say agonistic, we simply means it brings about relaxation of the blood vessel, thereby reducing the levels of hypertension. So in here, this is just a new group of agents that are selectively block the receptors for angiotensinogen 2 by blocking the action, not necessarily the formation of a natural chemical that narrows the blood vessel. For example, we have losartan. Losartan, you can give 50 milligram to 100 milligram per day, or you can give Vasatin, that is 80 milligram to 160 milligram per day. So this is just the drug dosage that you can give a patient for angiotensinogen 2 receptor antagonistic. All right. Then we have what we call calcium channels. Now, calcium channel, the word calcium, it makes the heart to feel, when the heart feels like it's the feeling of just calmness. It simply means that it has removed the pressure of the heart, the cardiac muscle. So these agents, they are just effectively reduce the blood pressure by helping relaxing the of the blood vessels. Some just usually slow the heart rate, thereby reducing the force of the cardiac contraction. That's what they usually work. They reduce the cardiac contraction and inducing what we call cardiac relaxation, thereby taking away pressure from the myocardial muscles, from the cells, the muscles that are found in the heart, which we call the myocardial cells, muscles. These drugs, example of such drugs, we have nifedipine. Nifedipine, it's a drug that is just hypertension, especially if someone has got systolic hypertension, 120 to 129 milligram. But if the systole goes above maybe 150 to 180 somewhere there, millimercury, sorry, no milligram, but millimercury. that one, when you take this nifedipine, it makes that pressure or the systolic hypertension to be low. Population that usually unresponsive to other antihypertensive drugs. For example, in Africa, where we find, like I said, in the elderly, where we have thiazides, we also use thiazide. Like thiazide, in elderly, you cannot give thiazide; it cannot be used because it will make them to become quiet. They'll stop doing activities, like they just lose the sense of sympathetic stimulation. They can't respond to anything than just sitting quiet. Morgan Monto at Vapasa Cotin. They'll be processing things very slow. And then these people, when they just put their hand on the brazier like this, they can even be bent. Because it usually takes time for them to feel that there is some stimulation here. They'll start thinking to say, where is my hand? So, it is on the brazier. So what is happening? I'm smelling something that is burning like a roasted meat. Before they realize, the whole entire hand has been burnt off. It is equally happened to those people that have got maybe paralysis of the limbs. Maybe this part is paralyzed. They don't feel any stimulation. They can't even flex their fingers like this because their brachial plexus, the plexus that usually makes them to make movement on their upper limbs, it is not performing according to the way it's supposed to be. Why? Because nerves have been denervated. Worse if it affects the plantar plexus. The plantar plexus, it's the one that usually controls the lower limbs. This is a situation where you find Montosayenda and Kalache, meaning that it has just affected their what? Their lower limbs. And when it has affected their lower limbs, those are the people that we tend to see on a wheelchair. And not necessarily that they cannot walk, but they cannot feel their legs. Yes, that's why it happens. A short-acting formulation of nifedipine should be avoided, a short one, as it may evoke reflex of what? Tachycardia. What is tachycardia? Remember your cardiac muscles, they've been dilated. And then here is now tachycardia as the side effect, where you are seated but you're panting, panicking when breathing, be the side effect. So that's the reason why we are saying give 10 milligram, that is Sabringo. You know what Sabringo means? Put in the drug and the Sabringo, 10 milligram, or oral, that is once daily. Someone takes it like that. Why don't you take it maybe 3 times or 4 times per day? Because it can make someone to become like a person who just becomes sympathetic, more like they are paralyzed, as if there'll be tachycardia and they won't be feeling anything. The sympathetic nerve stimulation won't be detected. It will be fully active of the parasympathetic nerve system. What are some of the side effects? It brings about dizziness, because here is a situation where the heart now cannot pump blood the way it was pumping. It is now pumping blood at a slow pace, and that will now make a person to start feeling dizziness. Yes, meaning that there is low oxygen, there is low levels of oxygen that is reaching to the brain, as well as nutrients, that glucose that is reaching to the brain cells. Then it also brings about fatigue, nausea, as well as headache and edema, like swelling, especially in elderly patients, in elderly people. It brings about what we call varicose. And this is a situation whereby an elderly person, just from nowhere, the legs will just start swallowing, like the legs are swollen all of a suddenly. Yeah. Now, what are some of the implications? You need to be watching for any form of swelling. And you need to advise your patient to take enough rest. You should also give attractive what? Food that will make a person to become stimulated. Yes. The other drug is amlodipine. Amlodipine. This one you can give 5 to 10 milligrams per day. The side effects include headache, sweating at night, as well as what? Palpitation. Why? The carbon dioxide partial pressure has been increased and the oxygen partial pressure has been reduced. The fifth one, vasodilator. Vasodilators, these are drugs that usually act on the central nervous system. They are also effective for antihypertensive drugs because just like from the word vasodilator, they usually dilate the blood vessels. In a particular, we have medications such as methyl dopa. Methyl dopa is effective in the treatment of hypertension in pregnancy. You can only use methyl dopa. Methyl dopa tablet injection, you can give it. Dosage 250. Okay, you can also give 250 olari, that is TDS, that is like as this one you can give, that is what, 3 times like daily. Then the side effects,
Which one?
TDS is twice, and 2 days, yeah, should be 3 times daily. Drowsiness. What is drowsiness? It's after a person is just feeling sleepy, that is drowsiness. Action, akankala, a person will sleep. It also brings about the general body weakness. The whole body is just weak. But it also, when you take this drug too much, meaning that you're reducing the level of blood reaching to the reproductive organs. Hence, it makes a person to become impotent. And then they'll have loss of what? Like as in have sexual dysfunction. They can't give birth. What are some of the implications? You should advise not to operate machines because because it can cause impotence. Ntenze chemushe but ankalache impotence, the impotence comes in. Okay. Then the other drugs we have hydralazine. So we have hydralazine tablets. You can give 25 milligrams as well as 50 milligrams. The dosage you can give 20 to 50 milligrams, that is 2 times daily. The side effect for these hydralazine tablets is that they usually stimulate headache and also flashing headache. That is a flashing headache. It brings about dizziness. Also increase in the heart rate as well as the cardiac output if the doses exceed 3 grams per day. So we should not overabuse it. What are the implications? You should be watching for what? Hypotension. The low levels, maybe when the blood pressure is reducing, you need to be watching so that you stop giving that drug because it will make a person land into hypotension. Then you should also give attention to the fluid retention. Okay, fluid retention, this is where you need to put a drip, maybe of normal for fluid retention in the body. Also, you should give what we call an adequate and other antihypertensive, hypertensive drugs. Okay, so then I can say we can end here. Thank you for attention. Ensure to subscribe to my YouTube channel. I'm your host, Morgan Epika Izurukama Jr. Shalom and God bless you.
So like this one, you have